It is Thursday night here at the Politics Bar. We are super duper geeked up for this.
I
the
know,
one,
we're
the only
such political nerds.
Dr. Annie Andrews coming into the bar this evening. Thank you guys for cheering her on. We really appreciate this. Look, it's a good crowd here at the bar. They're good people. And you are, I gotta say, I'm excited about what you can do. You realize you don't have any opponents right now, and technically.
I know. Why don't they just give me the seat? Seems to be the thing to do.
Well, yeah. Aren't they? Didn't they give the seat technically to Ms. Nordone? I don't know why she wants to be called Ms. Graham. Isn't she in support of the Save America Act?
It's going to save money on the seat. You know the.
Yeah, but Jody,
engraving fees,
right? Engraving fees,
but
right? Senator Graham, you know.
But she's in favor. Nadine is in favor of the Save America Act, and I'm like, well, if you're gonna, be against other women being able to change their name so they can't vote, I think it would be honest to, actually use your full legal last name.
I wrote a snarky tweet about that because the first thing Darlene did when she got to Washington, D.C. was, co-sponsor the Save America Act. And I said something like, lady who just changed her last name wants to make it harder for other ladies who changed their last name to vote. But I was told it was too soon. But
no.
But since then, she's called me the worst pediatrician in the country, so I don't have to dance gingerly around Darlene anymore.
Don't even bother.
Well, and look, and it could be her. It could be Ralph. Ralph could be your other opponent who's been there. First he was in South Carolina, I think, till 17, and then he's been in D.C. But he hasn't really done a whole lot other than kiss Trump's butt.
He hasn't done a whole lot, and he would be almost 80 at the end of this first term in the U.S. Senate. So as one of my good pediatrician friends described them as the mystery sister or the elderly millionaire. Those are my two options.
And look, I mean, there are things that they bolt on, and while we joke about Lindsay a lot, we have. He was known to have really good constituent services. So
yes, he was.
At least there's that. Yeah, see, and you're there. So
yeah, and I mean, at the beginning of his career, he did work across the aisle. Like he was a respectable Republican. In the John McCain, Mitt Romney.
Right.
Yeah.
Hell, he said He said Joe Biden was one of the best people ever.
Yes,
he did.
It's why
he was right.
Well, yeah. It's just. I look at places like South. I've been through South Carolina. I've stopped a few times. I lived down in Florida for 3.5 years. I live here in the DC end of the bar. Jody's at the LA end of the bar, and the whole other end of the country. But I've been up and down 95. I don't think I've ever taken State Route 17 to get over to Charleston. But
you got to come. I mean, and now we're first in the nations, and you got to come.
Well,
my sister shot a movie there called Shag.
Right.
Oh my God! Yes, I love that movie.
Oh yay! My sister is Carrie Hamilton.
Oh my gosh! Yes, that's such a good movie.
See, look at this. She has good taste, Jody. This is awesome. Well, look, your judgment is not in question as far as that goes, especially because, I mean, for those people who don't know, Dr. Andrews, she's been in South Carolina now, I think, for around almost 20 years. And you used to work at the Children's Hospital there. I'm trying to remember. Trying to remember what professionally. It's a pediatric. It's a specific type of a pediatric doctor. We basically stay in the hospital.
Yes, that's right. I'm a pediatric hospitalist. So it's an official subspecialty of the specialty of pediatrics. So I'm board certified in pediatrics and as a pediatric hospital medicine physician, because taking care of sick and injured kids in the hospital setting is very different than taking care of them in the outpatient setting. So over the past decade and a half, the field really evolved. And so now pediatricians are really split. The ones who work in the hospital, the ones who work in the outpatient setting. I love the fast pace of the hospital setting. I love that I make a decision in the morning and I see the results of that decision in the afternoon.
Nice.
I've worked in children's hospitals my entire legitimately 20 years this June. I've been working in children's hospitals. You only look like
you're 25. So
yeah, there's that too. I agree with that, Jody. Yeah. but here's the thing. My mom was an RN, and she worked most of her career in nursery, NICU, little L&D. So obviously kind of some overlap there. Yes. I always think of, when I think of my mom like that, A lot of people think it's all fun and cute. Oh, it's babies, and it's like, no, it's, you get some of those cases that are the worst, and especially these days with all of the loops and hoops that everybody has to deal with the stupid ass insurance that we've got, and the fact that Republicans keep trying to cut Medicare and Medicaid and the Affordable Care Act. And I mean, as a doctor, you didn't just have to understand the health of your patients, the physical systems, but you had to understand the insurance systems and the hospital systems and the bureaucracy. So this is not, dealing with bureaucracy isn't new to you.
No, not at all. And it's really the reason I got involved in politics. I mean, it's the broken healthcare system, the bureaucracy of the healthcare system, as we see the C-suite budget bloat and we see nurses, get cut and, don't get pay raises, but we've got more people who work in the C-suite. The process of taking care of patients over my 20-year career ended up being less and less time at the sick child's bedside, more and more time on the phone with insurance companies or working with the case managers and social workers to navigate where these kids can get their follow-up appointments, which pharmacy will pay for their prescriptions. The system is so broken. And that was part of what motivated me to get involved in politics. But really, it's the impact of broken policies on my patients and their families, that helped me understand I can take care of individual sick or injured children for my career, which is an amazing way to spend your time.
Sure.
Or I could go upstream and solve my patients and their families' problems at the federal government level. And that's what I'm aiming to do here in this race and in my first term as the next senator from the great state of South Carolina.
Amen.
I'm giving her the bell on that one because I do want to see you. I know. I
can't wait.
I want to see the people of South Carolina have a senator who actually listens to what they're saying. When you've been out, when you've been knocking on the doors, when you've been talking to the people, when you stop by like a home team barbecue or, I know you probably don't have time to hang out at Miller's in Charleston, the breakfast spot. Yeah.
So good. I think I've been there once the past 14 months, but it was delicious.
You've been a little busy, just a little busy. But when you're out and you're talking to people, what are they telling you? And does it matter to them that you're a Democrat or what kind of Democrat they think you are? Does any of that matter to them?
So I like the framing of that question. I mean, just like most people running for office, I'm hearing about gas prices, grocery prices, lack of affordable child care. I'm hearing here in South Carolina, more people than you would think are acutely aware of the role Medicaid plays in our healthcare system. And folks are worried and really upset about the impending Medicaid budget cuts. Their ACA tax subsidies expired, so their premiums have gone up. They keep paying more and more at the pharmacy for their prescription drugs. So I'm hearing about all of those kitchen table issues. I'm also hearing from non-Democrats, independents, and center-right Republicans about why do we pay their salary? They're not doing anything. Why is Washington so broken? We've got to change it. I'm just looking for something different. Especially a lot of, senior citizen veterans who just can't believe how far this country has really fallen on the international stage. People who are just setting partisanship aside because they recognize Washington is broken, which is why I think one of the reasons my candidacy is breaking through, because I am a political outsider. I've run for office once before, but I've never served in office. I have a different profession, a different whole, background of expertise that I can bring up there. But people also see me as someone who's just fed up like they are, but who decided to take that feeling and channel it into running for the U.S. Senate. And so I do think we're breaking through traditional partisan voting patterns because of how terrible this administration is and how just, totally ineffective the U.S. Senate has become.
What are your thoughts on Bill Cassidy? You can't say them on the radio.
I did, when he voted to confirm RFK Jr., I did quote tweeted him, and I said, I hope you never sleep well at night again. And I stand by that statement.
I'm with you on that.
Understandable.
I mean, he knew what he was doing was wrong, and he did it anyways. I mean, he's a hepatologist, and he voted to confirm the guy who, totally disrupted our distribution of an administration of hepatitis B vaccines, which have drastically reduced the incidence of chronic liver disease and liver cancer in this country. He absolutely knew what he was doing, but he was trying to maintain his allegiance to Donald Trump. And what did it get him? It got him a Trump-backed primary, and he got primaried out. And it just shows you that,
it's not worth it.
It's not worth it. And I talk to so many doctors who bring up Bill Cassidy to me, and they're so frustrated by, because I say we need to elect more doctors, and they're like, but what about Rand Paul and Bill Cassidy? I'm like, okay, we need to elect more doctors who care about patients and human beings.
Doctors.
Exactly. Elect more doctors that care. Elect more people that care. I mean, this is a reminder. It's really been a reminder. We've been talking to a number of different people. We had Ashley Bell, who's up the road in North Carolina, running for the House. In last week, we had Kurt from Ohio. He's a friend of Sherrod Brown's. We had him in Thursday. The things that we are hearing, both from the people who come to the bar and give us information off of their socials and private messages or whatever, and the stuff we see publicly, and the stuff that we're hearing from you folks who are out there on the ground, reminds me, and you and I have talked about this a bunch, Jody. We started to call this, Dr. Andrews, we've started to call it, as of, well, basically yesterday, the GTFO election. Because people will, back in 2008, when I worked on the Obama-Biden campaign in Iowa, and I've told the story, everybody around the bar here knows this one. We had a volunteer who she went out to a house, rural area, and screen doors open, knocks on the door, and sees this woman, and hey, it's just checking to see, are you going to vote in the election, and who might you vote for if you want to tell me? And the woman hollers to her husband, who we voting for? And the guy says, we're voting for and drops the N-word. And this woman just turns back to our volunteer and says, yeah, we're voting for the N-word. Right, I know, doctor.
I know.
Right.
Right.
But thankfully, our volunteer just kept face. She was fine. It was good. Just thank you, and okay, and may I ask why? And basically, the woman said, "We'll vote for anybody who will get us the F out of here. We don't. We're done with this. We're done with all the war and the bad economy." And what do you know? Now here in 2026. We're hearing the same thing from people across the board going, I don't care. As long as you're for democracy and capitalism that works, great. I don't care what your label is. I don't care what color you are. I don't care what gender you are. Get us the F out of here. It sounds like that's kind of what you're hearing from the people in South Carolina.
Yeah, I think that actually really pretty well encapsulates what I'm hearing down here, that people, when you're feeling the pain, like the real pain of not making ends meet at the end of the month, when you're watching us, write a blank check to fight this war, but we're cutting SNAP benefits and Medicaid, I think people do just, reevaluate, and they want to try something new. And that's why I think so many of these elections are going to shock a lot of people, because just like we had secret Trump voters that we didn't expect in 2016 and 2024, I think there's going to be a lot of secret Annie Andrews voters and Democratic voters all across the state and the country, because, they're not going to go out there and wear my t-shirt, but they're going to show up and vote for something different than what they've been voting for the past 30 years that has done nothing to help people here in South Carolina.
Right.
Good.
Right.
Good.
And Good. Look, you will, like the old-fashioned conservative people, the folks who used to do good, you will keep the good things, like, the great constituent services. You're going to serve your constituents extremely well.
Yes.
But then you're actually going to go to the Senate and actually get things done.
Right, because it's not a career I don't want this to be my career. I'm not going to operate in a way just to protect my own political future or to please the special interest groups. I'm just going to go up there to do the job. Like, why would I take all this time away from the career that I love, all this time away from my 3 children who I don't see very often anymore, to go up there and just sell out, or to just, shrug my shoulders and say, well, that problem's too hard to solve. I mean, we just need more people with that can-do attitude, like roll up your sleeves and do the job. And that's what doctors do every day. Like, we don't have the choice to just say, oh, that kid's too sick for me, I'm too tired today, or this is too hard, or I don't want to call that surgeon that I need to help me, so I'm just not going to do it. I don't go on TV and blame people for the sick patient in front of me. You just get the job done. Right. And there's so many professionals out there who go to work every day and get the job done, but that's really not the ethos of Washington, D.C.
But we need more people who have that ethos, that it is a job, that it is a public service job. I mean, you are a doctor trying to diagnose the illness. You have diagnosed the illness of our political system. Now you just want to administer the
The care.
Medicine. Yeah, exactly,
Right.
Jody. Yeah, the
That's
care.
right. The comprehensive treatment plan I have for what ails the United States of America.
I love that.
Amen.
And you're willing to work with whoever it is to make sure that we get things a little bit better, right?
Yes. Yes, because we're never going to get anything done if we just talk over each other.
Right, exactly. Hey,
Exactly.
Dr. Andrews, we got to, clean a couple things up and pay some bills. Can we keep you around for one more segment? I love the fact we have some extra time. We got to talk to you about the whole vaccine ridiculousness that Trump's been doing. Want to talk to you a little bit more about the war, obviously, the Abraham Lincoln and that whole thing. I mean, you
Yes.
got 6 major facilities down there in South Carolina. There are a lot of people who are veterans there, too. We got to talk with you. You good sticking around?
Yes, I can do that.
Thank you.
Yes, love that. Dr. Annie Andrews is here at the Politics Bar tonight, and we are thrilled about that. Look, freshen your drinks, do what you got to do, and, if you don't have a Politics Bar t-shirt, go check it out. Go to the Politics Bar store at thepoliticsbar.com. More with Annie Andrews next here on this Thursday night. Hang on.
We'll be right back after we pay some bills at the Politics Bar.